morning, everyone, and welcome to Breakfast at UMHealth live webinar series in conjunction with International Nurses Day. My name is Dr. Nadeeka Gunarathne, and I am honored to serve as the moderator for the Forum 1 in this morning. Before we begin the session, I would like to take a moment to reflect on the significance of International Nurses Day, which is celebrated globally each year on the 12th of May as the honor of the Florence Nightingale, the founder of modern nursing. The theme for the International Nurses Day this year, Our Nurses, Our Future, Empowering Nurses to Strengthen Economies, highlights the critical role nurses play not only in the healthcare delivery, but also in building stronger communities and healthier nations. Nurses are the backbone of the healthcare system. Their contributes extend far beyond the bedside care. They are educators, they are advocates, leaders, researchers, and decision makers. This theme reminds us when the nurses are supported, empowered, and invested in through education, leadership opportunities, and safe workplaces, professional development, the entire healthcare system becomes stronger and more resilient. It is therefore the timely that today's forum focus on empower to save, inspire to lead. As leadership and empowerment are the essential in shaping the future of our nursing and healthcare globally. It is my great pleasure to welcome our distinguished speaker, Professor Dr. H.D.W.T. Damayanthi from the Department of Nursing, Faculty of Allied Health Sciences, University of Peradeniya, Sri Lanka. Professor Damayanthi is a distinguished academic and nursing leader from the Department of Nursing, Faculty of Allied Health Science, University of Peradeniya, Sri Lanka. She holds a PhD in Nursing Science from the University of Malaya and advanced degree in Nursing Administration, Food and Nutrition, and Nursing. She career spans over 2 decades, beginning as a nursing officer in the Ministry of Health, Sri Lanka, and progressing through roles as lecturer, senior lecturer, and now becoming professor in nursing. She has contributed extensively to nursing education, leadership development, and health financing while serving as a resource person in numerous national and international professional forums. Professor Damayanthi has published widely in peer-reviewed journals, and she has received multiple awards, including the NRC Merit Award for Scientific Research, Robota Carey Prize for Excellence in Nursing, and Athabasca University Gold Medal for Excellence in Nursing. She is an active member of several professional bodies in Sri Lanka as well as in several international associations. Through her teaching, research, leadership, Professor Damayanthi continues to advance nursing practice, education, and policy, inspiring future generations of nurses and strengthening the role of nursing in global health. We are truly privileged to have you with us today, and she will be sharing her insight on the topic of empower to save and inspire to lead. Without further delay, I would like to invite Professor Damayanthi to begin her talk. Dear Professor, the floor is yours.
Okay. Hi, everyone. Very good morning to everyone, and Assalamu alaikum to you all. And thank you, Dr. Nadeeka, for your nice introduction. So I am honored to be with you today. So shall I share my slides?
Yes.
Okay. As Dr. Nadeeka mentioned, I'm going to talk about empowered to save, inspired to lead. So before that, I would like to give my greetings from Sri Lanka to all the nurses and all the people who join in this webinar. So we know, as Dr. Nadeeka correctly said, International Nurses Day 2026 theme introduced by International Council of Nurses. It is our nurses, our future, empowered nurses save lives. She clearly mentioned that nurses are the backbone of healthcare. So today I'm going to talk about how empowered nurses save lives worldwide. So when we are talking about empowerment, we can talk it in 3 different ways, like safe and fair work environments, professional autonomy and practice rights, influence and leadership in policy making. So, this is the theme of International Nurses Day today. Our nurses, our future, empowered nurses save lives. Nurses are the backbone of resilient health systems. We know about it. And empowerment strengthens leadership, advocacy, and innovation. Investing in nursing ensures equitable quality care worldwide. Empowered nurses drive healthier communities and stronger nations. Together, we nurses shape a future where nurses save lives every day. So, nurses as the backbone of healthcare. How we consider nurses as the backbone of healthcare. Nurses provide continuous, compassionate, and skilled care. Nursing is not episodic, it is continuous. Nurses are present at every stage of the patient journey, we know, from admission to discharge, from birth to end of life care. Their compassion is expressed in small acts. Let's see, comforting a frightened child, listening to an anxious family member, or holding the hand of a patient in pain. Their skill is evident in the precision of administering medication, monitoring vital signs, and responding to emergencies. This combination of compassion and competence makes nursing unique. It is both science and humanity intervened. We know their expertise ensures safety and quality outcomes. Nurses are trained to detect subtle changes in patient conditions, an irregular heartbeat, a drop in oxygen saturation, or early signs of infection. Their vigilance prevents complications and saves life. Quality outcomes in healthcare. Nurses are responsible. Lower mortality, fewer readmissions, higher patient satisfactions are directly tied to nursing expertise. For instance, infection control practices led by nurses in wards and clinics reduce hospital acquired infections. Their expertise is not just technical, it is holistic, ensuring safety in both physical and emotional dimensions of care. We know nurses lead in prevention, advocacy, and innovation. Nursing leadership extends beyond bedside care. Let's take a few examples in prevention side. Nurses run vaccination drives, nutrition programs, and health education campaigns. They are often the first to detect community health risks. When we consider advocacy, nurses speak up for patient rights, fair working conditions, and equitable access to care. They influence policy by bringing frontline realities to decision makers. Let's talk about innovation. Nurses design new care models, integrate digital health tools, and adapt practices to local needs. In Sri Lanka, we know nurses-led initiatives in telehealth and school health programs show how innovation can transform communities. I know Malaysia is the same. Nurses bridge patients, families, and health systems. They work as a bridge. They are the connectors. They translate medical jargon into language families can understand, ensuring patients know their treatment plans. They coordinate between doctors, allied health professionals, and caregivers, making sure no one is left out of the loop. Strong nursing means stronger, healthier communities. When nursing is strong, communities thrive. What does it mean? When nurses are strong, communities become healthier and happier. Families feel supported, patients recover faster, and public health challenges are addressed more effectively. So, empowered nurses reduce the burden on hospitals by promoting preventive care. They strengthen trust in health systems because communities see them as approachable, reliable, and compassionate. Let's talk about global nursing landscape. Workforce statistics, challenges, and opportunities. When we talk about the workforce statistics, according to the World Health Organization 2025, there are around 25 million nurses work in this world. It shows that the projected shortage by year 2030 is around 4.5 million. When we consider the demographics of nursing, nursing remains female dominated in everywhere in this world. So let's talk about key challenges nurses face during this time. The most important challenge is uneven distribution. We know wealthier nations retain stronger workforces, while low and middle income countries like us struggle to train and keep nurses. Another challenge is aging workforce. Many nurses are nearing retirement, creating sustainability concerns. Especially when we think about Sri Lankan situations, we are facing this challenge. The another one is retention issues, burnout, poor working conditions, and limited career pathways drive attrition. Systematic inequities, disparities in pay, training access, and infrastructure hinder global health goals. It is also kind of key challenge among nursing professionals during this time. Let's talk about emerging opportunities. We know the nursing have global demand. Countries like Switzerland, Canada, Australia, and Germany are actively recruiting nurses with competitive salaries and streamlined immigration pathways. Leadership roles. Nurses are increasingly recognized as policy shapers and innovators in primary health care. Career mobility. International placements offer exposure, advanced training, and long-term settlement options. Another emerging opportunity is technology integration. We know digital health and AI tools open new avenues for nursing practice and education. Global nursing innovations and AI in nursing education. Global nursing innovation and AI in education are not just technical upgrades. They are empowerment tools for nurses. They ensure nurses are equipped with knowledge, authority, and moral responsibility to lead health systems, inspire communities, and shape policy. By 2030, these innovations will make nurses central to achieving universal health coverage and building equitable societies. The power of empowerment, what is it? Granting autonomy, voice, and authority in decision making. It is the meaning of the power empowerment. It recognizes nurses as leaders, not just caregivers. It creates environments where nurses feel valued and supported. You can see this picture, how empowered nurses save lives everywhere. Let's talk about empowerment pillars. Here, I'm going to talk about empowerment pillars in three categories like safe workplaces, fair recognition, and leadership opportunities. Empowerment of nurses, why it is important? It improves patient care, reduce burnout, increase retention, promote innovation, strengthen communities at the end. Let's talk about safe workplaces. We should ensure adequate staffing and manageable workloads, protection from physical and psychological harm. We need access to proper equipment and resources. For example, PPE or infection control measures, safe patient handling, patient violence prevention, mental health support, emergency preparedness. Fair recognition. We need pay equity, equal pay for equal work across genders and roles. Recognition of nursing as a highly skilled profession, addressing disparities between nurses and other healthcare professionals. Awards and honors. Institutional awards for excellence in care and leadership, national and international recognition, celebrating contributions during Nurses' Day and public health events, and most importantly, visibility and respect, highlighting nurses in media, research, and policy discussions, ensuring nurses' voice are heard in decision-making forums, promoting public awareness of nurses' critical role in saving lives. Let's talk about leadership opportunities. We need to inspire nurse leaders, equitable care, community outreach, reduce burnout, resilient health systems. So we have to understand the pathways to management. Clinical leadership roles such as ward managers, unit heads, administrative positions in hospitals and universities, opportunities to lead multidisciplinary teams, and policy influence. It represents in health ministries and advisory boards. Nurses can participate in drafting national nursing and health policies, advocacy for fair legislation on workforce, safety and recognition, etc. And leadership development pathways. Let's talk about leadership development pathways. Academic pathways. We know we have advanced degrees, leadership modules, and research opportunities prepare nurses to take on roles in management, policy, and education. Clinical leadership. Senior nurses lead wards, specialty units, and crisis response teams, translating empowerment into ethical decision making and patient advocacy. And professional associations. Platforms like ICN and National Nursing Councils provide pathways for nurses to hold office, influence policy, and represent the profession globally. This is important. Global collaborations. Partnerships with institutions strengthen leadership through joint research, exchange programs, and exposure to global best practices. Innovation and AI. Nurses trained in digital health and AI become leaders in integrating technology responsibly, ensuring fairness and dignity in care. Another one is community leadership. Nurses lead public health campaigns, disaster response, and grassroots initiatives, embodying resilience and moral responsibility in times of crisis. See, nurses saving lives daily. We can see so many inspirational stories. We know nurses engage in policy development, sometimes in organizations like WHO. So this is also important when we are talking about empowerment of nurses. Ethics in modern healthcare. Empowerment is not only about authority, but also about moral responsibility. Nurses who are empowered can uphold dignity, justice, and fairness in complex care decisions. For example, end of life care decisions. An empowered nurse advocates for a patient's wishes regarding palliative care, ensuring dignity is preserved even when families or institutions push for aggressive treatment. Resource allocation, another example. In a busy ward with limited ventilators, an empowered nurse participates in ethical discussions, ensuring fairness and justice in deciding who receives critical equipment. Let's talk about innovation and public health and community impact stories. Preventive health education campaigns empowered communities to manage chronic diseases. And importantly, this nurses stay theme. It is not just a theme. It is not just a few words. It is a kind of call to action for institutions and communities. Call to action for institutions. Invest in empowerment, basically. For example, universities and nursing schools introduce leadership modules and policy literacy in undergraduate curricula. Hospitals establish nurse-led innovation units to pilot community health projects. Professional bodies here in Sri Lanka Nursing Council sponsor research grants for nurses addressing local health challenges. And especially future collaborations. Partnerships with foreign health institutions, universities strengthen our nursing capacity. Joint research projects address oncology, ethics, and AI in healthcare, for example. Exchange programs provide exposure to global best practices, and collaboration ensures nursing remains globally connected and locally impactful. We can do joint research, exchange programs, capacity building, and leadership development through these collaborations. And call for action for governments, especially on policy and funding. Ministry of Health allocates dedicated funding for continuing professional development and postgraduate nursing education in Sri Lanka. I think Malaysia is the same. National health policy integrates nurse representation in decision-making communities. Government partners with WHO and ICA to implement workforce retention and fair pay frameworks. And we need to think about call to action for communities. In this regard, respect and support is important. Community leaders and media campaigns highlight nurses as health advocates, not just caregivers. Local NGOs collaborate with nurses to deliver preventive health education, especially in rural areas. And public recognition programs celebrate nurses as heroes who make measurable community impact. And resilience in crisis. Nurses can continue to deliver care even when health systems are under strain. We know recent examples during various pandemics, disasters, or conflicts. Nurses stand at front line all the time. They adapt quickly and its scarce resources and provide emotional support. Resilience under pressure demonstrate nursing strength and courage. These are few examples how nurses continue to deliver care even when health systems are under strain, like COVID-19 pandemic, Ebola outbreak, recently monkeypox outbreak, and Ukraine conflict, Middle East conflicts, etc. So we have to think about our vision, at least for year 2030. We need to think strong leadership, ethical practice, innovation, and global collaboration. Under that, health system leadership, for example, empowered nurses across continents are stepping into executive roles, guiding hospitals, primary care networks, and national health strategies. Universal health coverage by 2030. Nurses will be central to achieving equitable access worldwide. Another important thing, ethical practice, whether in disaster zones, oncology ward, or community health, nurses uphold dignity and fairness in care decisions, embodying moral responsibility across cultures. Let's talk about innovation and AI. Advances in digital health, telenursing, and AI empower nurses everywhere to deliver smarter, more compassionate care. And importantly, global collaboration, partnerships across universities, professional councils, and NGOs ensure nurses remain globally connected while tailoring solutions to local needs. And architects of equitable societies by leading health systems, inspiring communities, and shaping policy. So, finally, thinking of empowerment, we as nurses together, we rise stronger. So, this is the end of my presentation. Empowered to serve, inspired to live. Our nurse, future, empowered nurses save lives. So, I wish you all a happy Nurses Day. Thank you.
Thank you very much, Professor Damayanthi, for insightful and inspiring presentation. So you have highlighted the importance of empowering nurses through leadership, education, collaboration, and compassion, while reminding us profound impact of nurses having on patient care as well as in the healthcare delivery system as a whole. We will now proceed to the Q&A session. So participants, you wish to ask question, maybe you can type in the chat box, or else you can raise your hand and maybe you can ask straight away from the Professor Damayanthi, and also you can type in the Q&A box as well. We will try to accommodate as many as questions we have very limited time. So is there any question from the participants? By the help, do you have any question? Maybe while they are preparing for the question, maybe I have a little query about this, Prof. Damayanthi. Right now, we know the nurses are the backbone. We are having shortage. So what do you think? What challenges do nurses commonly face when balancing clinical responsibilities together with the leadership role? I know that you are a leader as well as you are a clinical specialist. So what you can give us as a good advisors? How do we balance these two? Sorry, I think you are muted, Prof. Damayanti.
Yes. Yeah. Thank you very much, Dr. Nadika, for your, the nice question. So it is an important question. So as nurses, we have to balance our roles. It is a challenge. Yes. When I think about this clinical responsibilities and leadership role in the hospital setting, especially, we have a time pressure. We have a time pressure and we have role conflicts. For example, people expect caring from us. And in addition to that, we have the leadership role. So we have such role conflicts. And I think Malaysia is the same, Sri Lanka, we do have these limited resources. It is, when we have limited resources, it is a kind of, the important when we balance our role. And we have high burnout risk. Yes. So these
Same
are the things I can
question.
say.
Yeah, I think one of the participants asked, I feel burnout. What should do or can do? Because
Yeah.
the if you talk about the resources, the manpower is the issue because here was the shortage everywhere. So the nurses are burnout already. So what what is your good advice?
Yeah, actually, we have to think about psychological empowerment of our nurses because each and every, as I told in my presentation, uh, globally we face the severe nursing shortage. So, anyhow, with the assistance of the government, we have to manage this shortage. Then I think we can think about reducing burnout. Until then, it is bit difficult for us to think about reducing burnout.
Thank you so much, Prof. Damayanti. One last, actually, so we have another 2 minutes. What advices you would give to the nursing students? They are early career nurses. A lot of students has been joined with our forum, or else
Mhm.
early career nurses. How they inspire or aspire to become into a leadership positions because they feel burnout. They are, feel the negative feeling towards that. How do you inspire them?
Yeah, thank you again, Dr. Nadika, for your question. Yes, the most important thing is continuing learning, continuous learning. Yes, it is very important for early career nurses. And you have to seek for mentors. It is also important. And embrace innovations. Now we are in an area in AI. So we have to embrace innovation. So these are the important things like continuous professional development and seeking mentors and embrace innovations.
So, if you like to answer the very last question, I think can leadership be demonstrated without holding a formal leadership position? Can it be demonstrated, Prof. Damayanti?
I didn't get you, Dr. Nadika.
So, is there a chat box? There's a question. The can leadership be demonstrated without holding a formal leadership position?
Yes, yes, definitely. Leader should not be a big boss in the team. We should have leadership qualities. So let's say ethical decision making, communication, collaboration. So we can.
All
We
right.
don't
Thank you.
want to be a big boss.
All right. Thank you so much, Professor Damayanti, for your very insightful, sharing of your ideas as well as your expertise. So, at last, I would like to uh, thank you very much for Professor Damayanti for spending your valuable time with us. And I would like to give our sincere appreciation for you to sharing your valuable knowledge, experience, and inspiration with us today. So participants, thank you for joining the Forum 1 today. So I will continue, as we continue the celebration of International Nurses Day, we will now move on to our second session. So I will hand over our session to Dr. Nohanita to moderate the second session. Thank you very much.
Thank you, Nadeeka. Thank you.